Welcome to tonight's in-service. We're going to be talking about tuberculosis and OSHA. And Sam wanted me to include some enhanced OSHA regulations since we have a lovely pandemic going on, if you didn't already know. So before we start that, I just want to let you guys know I was watching the news, and I do some seminars here and there online, and the top 3 masks that the CDC is recommending are these type. I think you have one on, Maria.
Mm-hmm.
Of course, the cotton ones, but they said the fabric should be poly cotton. So if you're out shopping and you're having someone make a mask, maybe ask the people at the store, do you have poly cotton? Or the N95 respirator mask, obviously, or the cone-shaped one, and Fran has one on. That's a perfect one.
Okay.
That they're recommending. They did tests, and these prevent the droplets from coming and going. If you sneeze in your mask and vice versa, someone sneezes on you, it'll catch it. So
And
just
wear
want
it
to
on the
point
blue
that out.
side too, the blue side out, right?
Oh yes, so
Yes.
the white side goes over your face, and then the blue faces your audience. That's how the guy put it on the TV. I like
Okay.
that. So, and then obviously the N95 respirator mask, but they're trying to reserve those for healthcare workers working in hospitals and nursing homes, and then of course the police and fire and EMTs, especially since the paramedics and cops are usually the first ones that you see if you have to call 911. So the only thing with the N95 respirator mask is most of the time you have to be fitted for those by a respiratory therapist, and that's obviously only done if you're working in a hospital or a nursing home. So if you are ordering them online, if they're available, you know, you have to make sure you're ordering like the right size, because if you get the wrong size, it completely defeats the purpose. So, any questions on that? Okay. All right, so I'll do tuberculosis first, since that's kind of the easier of the 2 topics. So, tuberculosis is an airborne bacterial infection that often does not display symptoms until it's in the advanced stage. So if you have just been exposed to TB, you're more than likely not going to have any symptoms. Symptoms, though, do include cough. It can be a dry or wet cough, but it's a prolonged cough, talking over 2 or 3 weeks. Blood-tinged sputum, shortness of breath, severe night sweats, weight loss, and fever. Chest x-rays are obviously the best and most accurate way to tell if you have some kind of infection in your lungs. But the skin tests that we do, and obviously blood tests too, can help diagnose. So all healthcare employers issue 1 or 2-step PPDs upon hire. I think everybody in here got one upon hire. And they can also repeat them at their discretion. VNA does do them upon hiring, and Sam usually makes you guys get a 2-step PPD unless you're bringing in documentation. I think it has to be within that year. Then you don't have to do the 2-step PPD. But you have to have some sort of PPD. But now, the paper you just filled out, Maria, are the ones we're going to be given because they're not required every year anymore. And then obviously if you can't get a PPD, your chest x-ray, I think is good for 5 years. I have some aides that can't get a PPD, so they have to provide chest x-ray documentation. In 2018, there were 10 million cases of TB worldwide. 1.5 million people died from it. So obviously it's still a very significant lung infection, because you don't really hear about it, but it's out there. And most of the cases were reported in Southeast Asia, which I thought was interesting. And for TB, since it's airborne, N95 respirator masks, gowns, gloves, and face shields are the items that are required to be worn if you're going into like a patient's home or a room that has TB. So I have personally never worked with anybody that had TB, even when I did my hospital nursing and nursing home, but you know, it still is something that's obviously brought up every time you go get a new job or something like that. So, any questions on that? No? You guys are making this easy. Okay, so now we'll talk about OSHA. So OSHA stands for the Occupational Safety and Health Act. It was established by President Nixon's administration back in the 70s. It was to help protect employees and employers, because what was happening, there was a lot of people getting workplace injuries and there was really no set rules or regulations for people to follow. Because now if you get hurt on a job, you have to go to the hospital, and usually you have to go to one of those, Concerta is a big one I hear, to report your injury. But if you're severely injured, obviously they're going to take you to the closest hospital. But things were happening and there was no kind of regulations and rules going on, and people were trying to sue and then they were losing because there was nothing established. So the Nixon administration came up with OSHA. So employers must provide all active employees with a workplace-free environment from recognized hazards likely to cause serious injury or death. And believe it or not, healthcare employees, we had the highest rate of reportable injuries or workplace death. That was pretty significant, because I didn't read that before last year. I did this last year, I didn't read that last year. So, healthcare employees are often exposed to bloodborne pathogens and biochemical substances that can render serious injury or death. Healthcare employees and social assistant employees, meaning social workers that are going out to the homes, had the highest form of workplace injuries and illnesses across the U.S. I know some social workers that have been placed in some pretty serious situations because they're going into homes, often with mentally unstable people, and anything can happen. So that's what they mean by social assistance employees. Department of Human Services is in that category too. If you get a phone call that someone's abusing a child or something, those type of employees are exposed. And obviously Adult Protective Services, which we use here, they're exposed, but more so it's Department of Human Services for the kids, because a lot of times the parents are very upset and furious when someone shows up and accuses them of some sort of child abuse, and then they start attacking. So that was pretty interesting to read as well. Nursing assistants actually have the highest rates of musculoskeletal disorders and injuries due to heavy and frequent lifting and poor body posture. Because you're assisting the nurses, and a lot of times the nurses might be doing meds or getting vital signs. So if a patient rings a call bell, even in the homes, you guys are out there and there's a lot of times you're lifting. That's why VNA has done a really good job with establishing a policy. Even on the care plan, I think it's on the back, 2-person assist. And of course, when me and Claudia go out, we have to assess the house, because sometimes you get there and it's like, whoa, the case manager didn't mention this, and it's kind of like, how are the aides going to do this because the person is so heavy or they're bedbound? That's where we get into trouble with our backs, and then obviously years later things start to kind of creep up. Football players were also on that with their concussions. Unfortunately, we see a lot of that if you're a football watcher. Healthcare employers have to set a weight limit upon hiring that their potential employee has to read and sign. 25 pounds or less they're aiming for someone to safely lift by themselves. I know I've lifted heavier people than that, and sometimes it has been by myself, so we have to be careful. So let's see. Do you have any questions on that?
I just think with our plan of care, it's the mobilities on the front of the plan of care.
Right,
And you and
right.
I do have to, designate whether getting someone in and out of the shower, transport shower chair, or Hoyer lift. That's especially important.
Yeah, the Hoyer lift is a problem. A lot of families don't have one, or people don't know how to use them properly. Or sometimes the families aren't in the mood to show someone because they think they should know. I know I've encountered pretty much everything under the sun when it comes to, well, how's my dad going to get out of the bed, so. But the mobility thing is big. I like to make sure if they're just using a cane or a walker, I like to see them get up and down by themselves, just so I can make sure there's no incidences that could happen. I had one guy a couple weeks ago, I just opened, he was shaking like crazy, and I'm like, I don't know if I'm going to be able to do this. So, that's kind of things you have to be very, very, careful of. I know the two of you had a case where it was almost, both Sharons
Which one?
had a case, our poor lady that passed away.
Okay.
We had a case
Yeah.
where you both were calling me about the safety of her getting up and out of
I
her
forget.
wheelchair with the one leg missing, and
Yeah.
it
Oh,
was
yeah,
a
yeah,
disaster waiting to
Oh,
happen,
yeah.
so obviously we had to work
Oh, yes.
fast. And sometimes that happens, you know, some clients think they can do more than what they can, or they kind of fabricate to get the services, and then obviously when we're in the homes, and then it just, you know, so those are kind of reasons why OSHA kind of came about, because things were kind of just all out of whack. When you are sick or exposed to somebody that might have something like TB, you have to report that immediately to your employer. Obviously, if you're working in a nursing home or hospital, you have to gown up and wear certain things, but if you're in the home and you go to the house and they say, hey, grandpa just got diagnosed with TB, and you know you have no PPE, you can't stay. So the family may give you a hard time, but you know, you just can't do it, so. I don't think we've had any cases, we did?
We had one, but it was long before you,
Okay.
and it was not on my
Oh,
territory.
okay. Yes, but see,
But
sometimes
we had
things happen.
very special, it was a known situation, and they had absolutely the PPE for tuberculosis. There were heavy gowns,
Okay,
there was a special mask,
right,
like the respirator mask, and it was a limited intervention.
okay.
So, and that was a number of years ago. I haven't known one since.
Good, that's a good thing. We don't need any other stuff going on than what we already had.
Yes.
Okay, so that's one of the top things that we can do to prevent certain injuries and workplace illnesses is hand washing and disposing of needles properly. There's quite a few clients we have that take their own, do their own insulin injections. So we have to always make sure when they're doing that, they're properly disposing of their needles. If they don't have a biohazardous container from their pharmacy, I know a lot of patients use large empty milk jug containers that have been used in place of that. Now, I don't know how they're disposing of that. I know if you have a biohazardous box in your house, the medical supply company does come and pick them up, but I don't think they're picking up milk jugs with the empty needles or used needles, so I don't really know how they're disposing of that. Okay, so then it's going in the regular trash.
With a cap on it.
Okay, yeah,
Yeah.
so.
So if you do the milk jugs, what do? Just throw it in the trash?
I
They-
don't like milk jugs, I
No.
like something more like the laundry containers.
Right.
I
Yeah.
think that's more substantial
Yeah, that's
because
Yeah.
a lot of the milk things are thin plastic or
Right.
or
Very.
cardboard.
Okay.
Very thin.
But Pennsylvania doesn't have any state law, so
Right.
yes, they are thrown away in the trash. That's why I tell all of our team members, be awfully careful when you're collecting the trash, because it's the son-in-law sometimes. Sometimes it's not your patient,
Right.
Right,
so that we always want to be careful. But I really recommend coffee can, something with
I've seen those
tin
too,
or
yeah.
laundry.
Okay.
Coffee can.
with
Yeah.
a lid, so that
Okay.
something can't get knocked over with needles.
Right,
Okay.
falling
yeah.
out.
I think they should provide them with those small biohazardous containers, but you know.
I have to tell you, they're expensive and
They are
nobody,
expensive.
and nobody does come and pick them up.
No,
No, the pediatric clinic, they had to pay a whole lot of money because they do have to have them
right,
picked
right,
up.
right.
It's very expensive.
It is. I only know of 2 people on my list now who have it, and their adult children pay the expense, but it is an expense, so. But part of it's because they're in an apartment building that says they have to dispose of this the proper way. So, you know, if they lived in their own house where they're paying their own mortgage, I don't know if they would have that rule, but
Yeah.
it is expensive. It's over $100 a month for them to come pick that up, so. All right, so some of the enhanced workplace recommendations now, since we are in a pandemic, I'll keep it strictly to home care as Sam asked. Obviously, most of our states have mandated masks to be worn if you're not able to properly social distance, whether you're inside or outside. or you're obviously working around strangers. But if you're in your own home, you don't have to socially distance, and, well, they're actually recommending you do, but it's kind of impossible sometimes. So if you're coming out of your house, you should have a mask on. And I'm gonna strictly keep it to Pennsylvania. Pennsylvania says that you should have a mask on when you're leaving your house. Now, if you're sitting in your car driving, you don't have to have a mask on. If someone's entering your car, you need to have a mask on. If they're within 6 feet or closer to you, you should have a mask on. And I'm using the word should because it's not a law. And I don't think they're gonna make it a law. Because knock on wood, we'll eventually hopefully be out of this. But right now, since we're not, you have to have a mask on. So upon entering anybody's house, even a relative's house, you have to have a mask on. And when you're working with anybody, whether you're a doctor, a nurse coming in the house, CNA, someone delivering water, they want you to have a mask on. So that's that. And we know what's going on in the news and across the states. There's a lot of people who are very resistant to the mask. The masks are very uncomfortable for some people that have underlying conditions. Completely understandable, but unfortunately this is our new normal for right now. So that's one thing. Obviously hand washing is the #1 thing they want people to focus on, but clearly that has not really been enough. So masks and then face shields. I know a lot of doctors' offices are requiring face shields to be worn by their staff, especially if they're coming in contact with children under 5. I think down here in the children's clinic, I have seen some of the nurses and nurse practitioners wearing the face shields, but they're very expensive as well. So, you know, and PPE is very limited across the board. It takes months sometimes for us to get stuff, but things are starting to turn and go into a better direction. So the next thing, so face shields, mask, gloves. They weren't mandating the, what are those called? The gowns. We have the aprons, but some places now are requiring, I think for skilled nursing, I read on one of the websites I was looking on last night, that certain skilled home care agencies have to have their nurses and their aides wear gowns. Obviously the patients are a little bit more critical than what we deal with here. So, you know, they're in full, they pretty much want all of us in full PPE gear, but obviously that really can't happen. So the basics are fine, the masks, the gowns if you can, or our aprons are fine. And if you have, you can wear a face shield. I wouldn't object to anybody, you know, wearing a face shield. So for healthcare, for home care, we are in the medium to high category of possible exposure because we are going into the patient's houses. And again, we don't know who was in there before us, we don't know who's coming after, and if we're piggybacking off, if there's more than one agency, you know, you gotta hope that they're following protocol. So that's why home care is in that medium to high exposure risk. So medium, it says providing care to the general public who are not known or suspected COVID-19 patients, working at busy staff work areas within a healthcare facility. So we're a small office, so we're kind of condensed. So again, even when you guys are in here now, we try to space you out, but we're a small office, we're condensed, and then when you're going to someone's house, you know, most of us aren't working in humongous mansions where they're spaced out. We're all in close headquarters, especially if you're giving them a shower or helping them get dressed. And then when you move over to the higher category, it says entering a known or suspected COVID-19 patient's home or room, providing care for a known or suspected COVID-19 patient not involving aerosol generating procedures. So this comes into place where if you were to go into a person's house and you didn't know they had COVID, you're now exposed because there's no air circulating around like on the airplanes and in facilities where it's kind of filtering those particles out. It's not going to happen in their house. So there's a high possibility now that you may contract, you know, the same virus that they have. We've been very lucky, knock on wood, not a lot of staff and not a lot of patients have had COVID, but have they had it? Yes, and you know, unfortunately it's going to happen because, you know, it's just all over. But the good thing is in the Northeast, Pennsylvania, New Jersey, Delaware, New York City, New York, Massachusetts, the rates around this area have been steadily decreasing. Like, we're on a very good trend. To now where some of the schools that were gonna just do completely virtual have decided that, hey, our numbers are getting lower, we can now maybe bring the kids in 2 days a week. So that's a very good sign. Out west, it's a little bit more difficult. There's more people out west, especially in California. That's a very heavily populated state, where I read they're actually gonna mandate certain things in the law books temporary for their healthcare employees. And then down south, obviously, it's a big problem because they were one of the first states to reopen and one of the last states to kind of close. So they're kind of in trouble. But up in this region, we're actually doing really, really well. The COVID cases are decreasing, the amount of hospitalizations are decreasing, and the amount of ventilators having to be used are steadily decreasing. So that was really nice to read last night when I was doing some kind of final touch-ups for this. So they're saying that we're more than likely gonna have to keep wearing the mask through the rest of 2019. Supermarket trips, obviously when you guys go into homes. I think right now, we're not allowing the patients to go food shopping with the aides
Right,
because of the closeness of, you know, so now we're just making the clients give you guys a list and then we're food shopping for them solo. So that's a little change for some of the clients that like that interaction and getting out the apartment or the house, but, you know, due to safety concerns, I think most of them have understood that right now it's just a little too difficult.
I think there's a huge liability for us because we are a nonprofit.
Right.
And they are having some people now causing a lot of difficulty, you know, if they feel they can blame it on somebody else.
Right. So, yeah, any questions on that? So until there's more known about COVID-19 and how it spreads, OSHA recommends using a combination of standard precautions, contact precautions, airborne precautions, and eye protection, like goggles or face shields. So standard precautions is basically, you know, someone's coming in for a sick visit, they have a little cough, you're just gonna put your mask on and your gloves. Contact precautions means now you have to take it a step further and put on a gown. Airborne precautions means now you need an N95 respirator mask because it's in the air and it travels through the air. Even if you have the flu, that's considered airborne because if I sneeze, somebody can easily get it. And then eye protection goggles and face shields, so that's what the CDC is recommending for healthcare and all healthcare employees to have, just to kind of prevent the spread of the virus. But again, the PPE has been very difficult for many places, even hospitals, to get, which is completely unacceptable, but, you know, nobody was prepared for this. So, the CDC provides the most updated infection prevention and control recommendations for healthcare workers. So if you suspect that you may have been exposed, you know, you're immediately going to call the agency. You know, such and such had a dry cough, or such and such had a very high fever. You know, more than likely we're going to tell you to contact your doctor, and then your doctor will then determine if you should get a test. I'm not sure right now if you can just walk in and say, hey, I want a COVID test. I don't think they're doing that. I think you have to have some kind of underlining issue, possible exposure. They were making you get a doctor's note, but I think that's been eradicated because people, it was kind of like impossible to get a hold of your doctor. And then how were you going to get the note anyway? They weren't opening up the offices, so it was like, how were they going to give you the note? So I think now you can go and there's a checkoff questionnaire and then they give you your test. Now the tests were taking up to 3 to 4 weeks to come back, but now they're at kind of like a 2-week standing where they'll come back. They're also now doing mouth swabs. They're doing those for the college kids, and instead of just going right down your nasal passages. College kids returning to campuses have to be tested every 4 days. So that's going to be very interesting in the next couple of weeks because they're starting to go back to campus. now what's gonna happen? So, and they're allowing them to sleep in the dorms together, so this is gonna be very interesting the next couple of weeks or months to see if we're still on our downward trend. So, and there was a lot of false positives going on in the beginning, but now they're kind of starting to see that most of it was because of improper testing, mishandling at labs, which is not comforting to hear, but when you have massive amounts of tests coming in at a rate that you've never seen before, obviously there's going to be some issues. So that's what they're making people do.
Well, what do they do when they test you? They stick something in your mouth? Or
Well, the best way to test for this, it was going through your nasal passages
Yeah.
and partially into your throat.
Oh, geez.
So obviously it's very uncomfortable. Good luck getting the children to do that, because I can
It's
only
not gonna
imagine.
happen.
So now they've come up where they're doing some swabs, and I think in the hospitals, I don't know how they were doing this in the hospitals, when they were fast tracking to see which ward they were putting you in, I don't know if they were doing swabs or down the nose. I don't know.
They were doing down the throat, they did it
Down the
to me
throat,
twice.
okay.
I mean,
Yeah.
really down the throat.
Okay. Yeah, if you get a strep test, they have to really kind of go down your throat too, so it's not comfortable. It's
Well,
really
they do
not.
it both because.
Say that again.
They do it both because when I get tested, they do it to me sometimes, they do it to my nose.
Oh, okay.
Right, that's the
Okay.
most common.
Yeah, yeah.
Uncomfortable.
Yeah, COVID has actually been around for a long time. If you read the back of Lysol wipes, it says if you wipe down the surface, it does remove. So COVID has been around for a long time, but no human exposure has happened until last year. So it's not a new virus, it's just new to the human body. So, yes.
I was doing some of the reading though, and it said that actually the rhinoviruses, our cold virus, is part of that group of coronaviruses.
Oh, okay.
Okay?
Okay,
It's just that it's a big group.
right. And there's
So-
different forms of it, there's
Yeah,
different
there's
strains of it.
Newer strains that
Yeah.
are very dangerous.
Right,
The
There
bird flu, the,
MERS.
yeah, MERS from,
right. So there's different strains of these things. Obviously, if you get a little bit more of a worse strain, you're gonna be sicker. And then there's mild, and I think that has to do with if you're asymptomatic or not. I think if you're asymptomatic during the whole duration of your you more than likely have a milder form of it, as opposed to people that are, because there's been very healthy people getting sick and dying from this. So it's not like, I don't think it's really fair to now say that if someone's completely immunocompromised, they're more than likely going to pass, because I had a patient that had it and she's completely immunocompromised. She's obese. She has COPD, she can't hardly walk, she can't breathe. And she got COVID and she is completely fine. Whereas somebody, a 34-year-old man who ran and jogged every day in tip-top shape died from it. So I think it all depends on what strain you get of it. That's just my thinking, but,
Yeah, that's-
yes,
I think we forget that it's a virus,
right,
and hepatitis C is a virus, and for a long time, we had no cure and didn't really know, and there were carriers.
right,
There
right,
were people that had hepatitis C that had no symptoms whatsoever of damage from it, but they were carriers and they were transmitting it. So I think there are certain characteristics of some viruses,
right.
and I don't know that we understand it all.
Yeah, that's why it's gonna be hard, that's why it's hard now, they're trying to figure out what we should do, because, one day it wasn't airborne and now they're saying it's airborne, so it's like, and it's a virus, and viruses are very hard to treat because there's really no medication that's gonna take it away, like a bacterial infection. It's more so gonna treat your symptoms, but there's been lots of steroid treatments that have been given for this, and I asked a couple of my family members that still work in the hospital, what have you guys been using? A lot of them are using steroid treatments, steroid antibiotics, and then the inhalers, and it seems to be really, really working. But with steroid use, obviously you're gonna have some other issues, especially if you're a diabetic. Diabetics and steroid use are kinda like, it's really tough, so somebody coming in with that, I know listening, like they've been harder to treat people coming in with underlying heart conditions, they've been a little harder to treat. So this is a virus that is a multi-system attacker. It doesn't just attack your lungs. It can attack your whole body. There was a guy that just died a couple weeks ago. He was on Broadway and it ate his legs off. So
Right.
it's not good. So
What?
it's not like the flu. I know
Yeah,
there's been
it's
lots
like
of
amputated.
people saying, oh, it's similar
He
to
just
the
had some other
flu.
complications,
Yeah,
and he was a perfectly healthy guy.
right.
I heard that for most people, it stays in the upper lungs. It's when it gets to the bottom of your lungs, that's when it gets serious.
Well, yeah, similar to like pneumonia,
Right.
and especially if, now the problem was in the beginning, people were told to just go to the hospital when symptoms kind of were like bad, but it's like, I don't know if that was quite good advice. Because if you're coughing and coughing and coughing and coughing, you know, that's gonna cause some problems.
Mhm.
You know, your chest is gonna start to hurt, your throat starts to really get bad, you know, you're not taking in proper food and hydration when you're feeling crappy anyway. So I didn't like a lot of the doctors saying that, well, we only want you to come to the hospital when it's like this, but I understood why they were doing it, because they were trying to prevent the spread. So, but yeah, some people have not been so lucky with this, whereas others have, knock on wood, had a very full recovery. And most people do recover from COVID-19. But of course, they always have to report the deaths so they can kind of get an idea of how fast things are spreading and how sick people are getting and how long did they have it before they turned south and eventually expired, so, you know. But a lot of the states that had these humongous morgue trucks, they don't have those anymore because again, the death rate has slowly been going down, but now we're coming into the colder months coming up where the viruses are more alive, so hopefully they don't want to see a surge. So I think that's why a lot of these schools are trying to keep these kids out of here and away from each other until, you know. But then a lot of them are saying until November, but November, that's when it really starts to kind of get cold. So I honestly don't know what's going to happen. And then Dr. Fauci has been a great resource. You know, he's kind of optimistic. He feels that we're not going to have a bad fall because of certain trends, but you can't predict the future. You know, you can't predict the future. That's kind of what I've been telling patients that ask me a lot of questions about this. I don't want to give them false information, but you know, when they ask me, do you think it's going to be a bad winter? I can't answer that. None of us can. So we just have to kind of see. We could have a very mild winter like we did last year. We hardly got any snow. So, you know, you just never know what Mother Nature is going to bring.
Right.
So, anybody have any questions on that? Okay. None? You guys made it easy. It's a lot of information. What time is it? Okay, well, just about at the mark. Thanks, Fran.
You're welcome.
Yeah, now if you wanna eat, this is one